In 2010, Public Health Review said that the vitamin D deficiency pandemic is a forgotten hormone important for health. Hormone, that's the key word in this. We used to think it was just a vitamin because in the 1940s, 100 units of vitamin D a day, well, that was considered sufficient to prevent overt skeletal deformities, which we used to call rickets. No one has seen rickets since then because vitamin D is in milk and other products. Regulatory agencies in the United States and Europe later increased that dose, double, to what they recommended as 200 units of vitamin D a day, which they said was required to satisfy the requirement for children. But then you have to ask yourself some serious questions. And that's what I'm going to try to help you with today. Hi, everyone. I'm Dr. Mitch, the Chief Medical Officer of Hue Light USA. This is the Daily Dose with me, a Hue Light web series. You should know that the body requires and uses 4,000 units of vitamin D every single day. 4,000. So you can imagine if your doctor or you yourself are taking only 2,000 units a day, you're hardly meeting the requirement for optimal health. As a matter of fact, even though that most of the labs basically say that anything over 30 is considered normal, be aware that the optimal doses, in my opinion, are 60 to 100 and sometimes even more than that. And getting there is not as easy as you think. You have to get a blood test, which will determine where you're starting, and then develop what, how, and how much you need to take. But before we get there, let me tell you some of the newest journal articles and things about vitamin D that probably you might not have seen and how important they are. First of all, in a very recent journal, they found that vitamin D helps treat type 1 diabetes. Now, I remember years and years ago an article about if you give a baby 1,000 to 2,000 units a day, 1,000 to 2,000, not the 100 to 200, that there's an 85% chance if you give that to a baby in the first year of life, that they will basically have 85% decrease in type 1 diabetes to begin with. What a great insurance policy. So check, of course, always with the pediatrician first. But in addition, we also now with this article are saying that if we catch early enough this type 1 diabetic, that vitamin D may help the parameter so that it does not worsen and less insulin requirement is needed. Tufts University also did an interesting article not too long ago where they called out the fact that Alzheimer's Association noted 55 million people worldwide were seen as having Alzheimer's disease. And when they did a study post-mortem, which means after death, where they looked at the brain, they noticed that increased vitamin D, those that had the highest that had died, had the best cognition compared to those that had little. So early onset dementia was again looked at in the journal of JAMA, the Journal of the American Medical Association neurology component, and they noted that increased risk of 40% of early onset dementia in folks that had low vitamin D. Here's another for men that probably you haven't heard. It seems to be, according to the Journal of Men's Health, a potential factor in erectile dysfunction as well. Not just the testosterone, not just poor blood supply, but even low vitamin D level. And for athletes, it's been reported out several years ago that without a good level of vitamin D, you're not going to get the repair and muscle function that you're hoping to get. Let me focus on the last component of today's program to think about, which is the VITAL study. That's VITAL. That study was done more than 5 years and more than 13,000 people were involved in this. They noticed that there was an overall decrease for advanced cancers by 17%. They also noted that people with normal body mass, meaning those that weren't heavy, etc., they had a 38% reduction for advanced cancer. So this particular study overall showed that there's pretty much no difference in the cancer rates depending on the vitamin D level, and I'll have something to tell you about that in a moment, but it did decrease cancer-related mortality. And by the way, they found that people that are diagnosed with similar cancers in the summer actually live longer, and they believe that's because people start to take some more time, get out into the sun, and also get some more time down, and that vitamin D, which is converted from the sun, it helps them too to live longer. And by the way, when a study says that they didn't see any difference in the cancer rates to begin with, there are other studies that say that does. Other studies show that when you are in the optimal of 60 to 100, you may actually decrease the risk of both prostate as well as breast cancer. So think about this. A decrease of cancer, an improvement in sports and healing, a decrease in mental disease, cognition, that just for a few of the literally dozens of indications for vitamin D as a hormone. Doesn't it make sense to get your vitamin D level checked and see if you're in the optimal range from 60 to 100? And if not, consider repletion with a good vitamin D3 substance. If you like this content, please like and subscribe, hit that bell below so that we get you notified as soon as we put out more content. This is our Daily Dose, and I'm the Chief Medical Officer, Dr. Mitch Ghen, for Hue Light USA. Thank you so much for watching.